Thank you for joining us today. My name is Anis Benbrick. I'm the convener of this third panel, Evaluation in Times of COVID in the Global South. I'm very delighted to be with you here. Thank you for joining us. Today we'll have 4 papers. Each speaker will have 20 minutes presentation, followed by 5 minutes question and answer. Without any further ado, let's start with our first paper, Rethinking the Transformative Role of Social Policy, Critical Insights on Zimbabwe's response to the COVID pandemic by Clement Chipanda and Tom Tom. Clement? So please introduce yourself, and you have 20 minutes presentation followed by 5 minutes Q&A. If you have any question, please raise your hand or use the chat box below. Hello, Clement. Can you hear us?
Hello, how are you?
Good, good. So you
Can you hear me?
Yes. So we
Okay.
can share your presentation using the share screen.
Okay, morning everyone, and thank you for having me. My name is Clement Chipenda, and I'll be making a presentation titled Rethinking the Transformative Role of Social Policy with Critical Insights on Zimbabwe's Response to the COVID-19 Pandemic. And I'm a postdoctoral research fellow with the University of South Africa, and I have a co-author. His name is Tom Tom. He's also a research fellow with the Sachi Chair in Social Policy at the University of South Africa. And concurrently, he's also a senior lecturer with the Department of Development Studies here in Zimbabwe. So in terms of background, when we look at the COVID-19 pandemic, I think it has had unprecedented social, economic, and developmental challenges globally, and Zimbabwe has not been spared from this. And while it has been catastrophic, I think it has also had the importance of revealing challenges in terms of social structures and also inequalities. So when we look at the emerging evidence, I think it has shown to a large extent that there are existing inequalities which maybe previously had not been seen, but which are now being exposed due to this pandemic. And there's also the ethnic dimension of the pandemic, and also showing the deep-seated differences geographically. And when it comes to our context for us countries in the global south, I think the situation has been made worse in a context where the public health system itself has been compromised. And in most instances, you find that it has largely been underfunded over the past few years. And I think this has to a large extent compromised vulnerable populations. And we are looking at it in a context where there have been persistent health challenges that have faced the populations. And I think in such a context, questions are now arising that since 2020, we've had challenges with COVID-19. What has been its impact in both short-term and also in the long-term context? And I think we are looking at it from a context where for countries like Zimbabwe, which have a history of settler colonialism, post-colonial developmental challenges, and also institutions that have been largely dysfunctional and persistent poverty and inequality, questions are now arising as to the impact which the pandemic is having on these countries, particularly in the global south. And when we look at the COVID-19, I think in the past year, when it started, there were fears and projections that it would have unprecedented impact on especially in Africa and in developing countries, with projections that the number of fatalities and its impact would be so huge. But fortunately, I think this has not been the case. Although there are increases in the number of cases, but we find that it is not as bad as what was previously projected. So when we look at the Zimbabwe context itself, as of yesterday, there were 51,000 confirmed cases and 1,808 deaths due to the pandemic. So it has not been as bad as was previously feared. But even though this has been the case, you find that since 2020, there have been a number of responses by the state that has been aimed at mitigating its spread and also trying to minimize its impact. So this is where our paper comes in. And it is crystallized around the idea that when we look at Africa and also the rest of the world, you find that the social policy paradigm, we are arguing that it has an important role to play, particularly in this pandemic context. And our paper is premised on the idea that it is critical to understand the social impact of COVID-19. And also, it is also critical to understand the role of social policy, that is, in the way that it mitigates vulnerabilities, in the way that it deals with risks and shocks, especially among the poor. And as a contribution maybe to knowledge or maybe to ongoing research, our paper comes in a context where the issue of COVID-19 is still emerging, and there's what we would see as a thin empirical grounding on understanding the nature and impact which COVID-19 has had on countries. So our paper, here I present on the methods and also the questions that motivated the paper. You find that our paper, we employ an interpretive research approach, and it triangulates official documents, media reports, and secondary literature. Our paper is not actually based on fieldwork or empirical evidence, but it uses that approach of mainly relying on secondary literature. The central research question that our paper asks is how a country like Zimbabwe, which for decades has faced persistent socio-economic and political crises, managed to respond to the challenges which have been posed by COVID-19. And our argument is that while COVID-19 has been catastrophic, it has also had some positives in terms of presenting an opportunity for us to critically reflect on the country's social policy architecture. And I think by extension, this can also be applied to other countries in the global south. And in terms of contribution, I think our conceptual contribution is that when we look at the challenges posed by COVID-19, we argue that the country's social policy architecture, as we shall show later, has had serious shortcomings. Hence, we argue for the need to rethink social policy in a context of what is known as transformative social policy. This transformative social policy is what I will try to touch on in the following slides. In the transformative social policy, we argue that it's a conceptual tool on one hand, and also an evaluative tool in which we can use to analyze the country's response to COVID-19. And it's premised on the logic that the social policy regime, as we know it in the global south, is dominated by the neoliberal paradigm, which provides a state-centered discourse on welfare and which there is an argument that it has actually derailed social policy from its founding objectives. And the transformative social policy framework actually argues that when we look at neoliberal orthodoxy in social policy, it becomes problematic as it lays an emphasis on a residual and reductionist approach to welfare. We see the market being used as a tool that is used to mitigate and respond to the vagaries of the life cycle. It also argues that when you look at social policies, it has been reduced to social assistance and regressive monotasking. Therefore, the emphasis here is that we need to return to the wider vision of social policy. And this wider vision is premised on the interconnectedness between social and economic policies, the fulfillment of the multiple and linked tasks of social policy, with the argument that social policy has to have outcomes that touch on production, redistribution, social protection, reproduction, and national building. It has to be prophylactic and response to vulnerability interventions ex ante rather than ex post. There's also the argument that it has to address vertical and horizontal inequalities with the aim of reducing poverty, enhancing the reproductive capacities of citizens, redistributing resources, and ensuring social cohesion. There's also the argument that it has to discard the idea that social policy can be used to clean up the mess or challenge of diswelfares that are caused by economic policies. So based on these points, the argument in our paper is that transformative social policy actually presents an alternative for countries which have unsuccessfully for the past decades experimented with neoliberal social policy regimes over the past 30 to 40 decades. I'll now go to the issue of the state responses to COVID-19 in the Zimbabwe context. And the first point that I need to highlight is that in the country's response, it was guided by statutory instruments which formed the legal basis of government action. Any action that the government did was actually guided by these legal instruments, which are known as statutory instruments. And in the initial period when COVID-19 started, that was in early 2020, there was the declaration of a national disaster, which was considered more appropriate at the time and allowed for the government to move expeditiously in response to the pandemic. It was an alternative to the more bureaucratic state of emergency. There was the launch of a national preparedness and response strategy to COVID-19, and the creation of an interministerial task force on COVID-19. You find that these were set up in 2020 and they've continued to date. So there's been a national response which has been guided by a first plan, which is based on epidemiological advice with alert levels that move up and down that actually guide the national measures. And this determine whether the country is going to under lockdown or not, and the levels in which the government actually puts in measures to control the pandemic. So when it comes to the particular social policy responses, you find that in Zimbabwe, it was built around an already existing social protection or social policy architecture. And I just highlighted there that it's worth noting that initially, when Zimbabwe gained independence in 1980, the social policy trajectory was expansionist and socialist in orientation, with the post-independence aim of addressing inequalities that permeated across race, gender, and class. But with the adoption of neoliberal social policies, especially after the 1990s, you find that this has changed. It was the responsibility of the Minister of Public Service, Labor and Social Welfare to spearhead the country's social policy responses or social protection response to COVID-19. So while there's a corpus of social policy responses that have been in place to mitigate the impact of COVID-19, we zero in on three, which are food mitigation measures, cash transfers, and health interventions, which we think that from a social policy perspective were actually important in understanding the country's response to COVID-19. When we look at food mitigation and cash transfer, you find that food mitigation intervention, they actually preceded the pandemic. But when COVID-19 came, it actually saw these interventions being reprioritized and reconfigured to deal with COVID-19 induced food security challenges. And I think we also need to bear in mind that Zimbabwe, just like most countries in Southern Africa at that time, was actually suffering from food insecurity, with a humanitarian appeal being issued to the tune of $331 million to cater for over 7 million destitute urbanites and rural dwellers who were food insecure. So this was the background of the food mitigation and cash transfers. So the specific food mitigation and cash transfers, I've highlighted them above on this slide, and they show that there was the provision of grains in both rural and urban areas. There was the disbursement of that's Zimbabwean dollars 25.2 million to 63,000 households in the country's 23 poorest districts, and this was in a cash transfer program. There was the setting up of what was called the COVID-19 emergency cash transfer program that was aimed at providing immediate relief to people affected by COVID-19. And it had an initial amount of about $8 million, with individuals set to receive. Initially, it was in $180, but it was later revised to $300. That was for 3 months. And the target was 1 million vulnerable households. In May 2020, there was the unveiling of a COVID-19 economic recovery stimulus package that was worth Zimbabwe dollars 18.2 billion. And to show its nature and its extent, it was valued at 9% of GDP, or 28.6% of the national budget. And this was an increase or an improvement to an earlier package that had been released in April 2020 that was worth 20 million United States dollars. And that had been unveiled for different interventions to actually fight the pandemic. Of the stimulus package, you find that 2.4 billion, that was Zimbabwean dollars, was earmarked for the cash transfer program to mitigate the impact of COVID-19. And by November 2020, it had been reported that 202,000 households from the country's 10 provinces had actually benefited from the disbursements. And there I'm just highlighting the criteria that was used to select beneficiaries. They actually used a database that was already in existence from the Social Welfare Department of people in need of social protection. So they were just added. There were others that came in from other ministries like Women Affairs, local authorities. These include the local municipalities and councils, and also informal sector organizations. And there was an indication by the Ministry of Finance that it would employ what it called a sophisticated algorithm that would be used to identify vulnerable individuals. And they said that they would do it through bank accounts and by analyzing bank accounts and mobile wallets. This was a bit controversial because many people didn't understand how they would actually carry it out. So that just highlights the beneficiaries that actually received assistance through food mitigation and cash transfers. And on the other end, there were health interventions. And I think we need to understand that given the importance of COVID-19 as a health issue, health interventions were pivotal given their centrality in the social policy architecture. So the country, and for the country, COVID-19 came at a time when the health sector was already had challenges of underfunding, as well as staff and equipment shortages, and the burden of disease, some of which was treatable. So we just highlight some of the interventions in the economic stimulus and recovery package, in which funds were availed for infrastructure rehabilitation, the construction of isolation centers, the provision of equipment, staff recruitment, and other urgent needs. And this sector was allocated 739 million Zimbabwean dollars. You also find that there was funding that was provided for motivation, health insurance, as well as sickness and death allowances, that if you are affected by COVID-19 or if you die from it, there was $1,000 that was availed and is still in place to compensate your family or yourself if you are still alive. So for the health sector, COVID-19 was critical in highlighting the challenges in the health delivery system. And the government acknowledged that there were challenges given the response of some health facilities and their failure to provide basic care. And it actually brought important lessons for the need of reforms to actually build a resilient health system that is responsive to future shocks. So in our paper, we have a brief discussion which we base on our observation, in which we argue that the social policy response of the country to COVID-19 actually highlights weaknesses in both social policy discourse and practices we experience it in Zimbabwe. And I think this has to be situated in a historical context where the social policy paradigm itself is grounded in neoliberalism, hence the failure to deal with structural inequality. So a critical analysis on colonial and post-colonial social policy will show that the current policy that we have, firstly, it doesn't challenge power imbalances, it doesn't seek to reduce poverty, and it has failed to address structural inequalities, that is across class and gender. On the other hand, it has impeded wealth distribution. And these things, I think we actually show in our paper that they became evident when we critically analyzed the country's social policy responses to COVID-19. When we look at those who were targeted by the cash transfers, you find that the majority were already vulnerable people who were already on the social welfare database. And I think this points or puts a critical question on whether social policies have actually been effective tools over the past years in reducing poverty, in redistributing wealth, creating employment, and enhancing livelihoods. I think this is in a context where there is a cycle of the vulnerable actually benefiting from cash transfers and food transfers in a pandemic context. I think for the Zimbabwean context, I think it may be different from other contexts, that it was unique in that the cash transfers were paltry and the situation was worsened by a hyperinflationary environment. And I think we tried to put it in context to show that there was $180 which was being provided, which was later reversed to $300, but this was worth just United States dollars, $1 to $2 at the time. And this was a monthly amount. And we look at the food monthly basket that was calculated at the time to show that at some stage in April it was 7,000, at another it was 14,000, and at another stage it was 20,000. The other challenge was that the stimulus package did not inject any new funds in the economy, but it only entailed reprioritizing and diverting existing funds. Food assistance, we argue that it was inadequate. There was the challenge of the absence of supporting laws. And you find that the cash transfers, which were a citizen's right, were not binding and remained as charity. The other weakness was that the selection and disbursement of COVID-19 funds was not clear and was contentious, and to date it still is contentious. So when we reflect on COVID-19 response, we actually argue that it demonstrated the diminished capacity of the state to provide adequate safety nets. And the social policy regime as it currently exists, I think we argue that it has not addressed inequalities, it has failed to be transformational, and it is actually not designed to empower citizens. I think that's the argument that transformative social policy poses, that social policy does not have to be just welfare, but it also has to enhance the productive and reproductive capacities of individuals while also reducing poverty. And COVID-19 has actually shown the shortcomings of social policies that are grounded in the neoliberal discourse, especially in developing countries. We also posit that COVID-19 revealed the need for countries to rethink and to adopt social policies that are progressive, that shape patterns of production and redistribution, and address the origins of inequality, poverty, and also ensure social justice and a balance between social and economic policies. And when it comes to the health sector, we reflect that it has also shown that in the health sector, neoliberal trajectories have been a challenge as they've reversed early gains from independence. And this is shown by the failure of social policies to actually respond to the immediate health challenges that were brought by COVID-19. And I think the arguments in the other on food mitigation interventions and the cash transfers, I think most of the arguments are actually applicable also to the health interventions. And I think in conclusion, I think a major takeaway from the Zimbabwe COVID-19 experience and also a major takeaway from our paper is that when we look at the COVID-19 response, there are important lessons there in terms of social policy making and also in terms of social protection in particular. And the absence of and we argue that the absence of a strong social policy regime that puts emphasis on the multiple functions or tasks of social policy, that is production, redistribution, social protection, cohesion, and reproduction, can be problematic, especially in times of crisis like the COVID-19 pandemic, as it actually sees failure to respond to immediate needs and also the long-term needs of citizens. This is why in our paper, we argue that there's need to rethink the social policy paradigm, particularly for countries in the global south. So thank you so much. I think I'll end my presentation there.
Thank you very much, Clement, for your presentation. Now, if you have any question, please raise your hand or use the chat box below. Any question for Clement? There is no question. Let's move to the second paper. The need for developing social protection and social welfare policy to respond effectively to COVID shock in Yemen with Rabia Salah. Rabia, we have 20 minutes presentation followed by 5 minutes Q&A. The floor is yours. Rabia?
I think Rabbi Salah is not in the conference yet, so there might be a need to skip his or her performance and go to the next one.
Okay, so let's move to the third paper, Faith in the Times of Corona, the case of Rohingya faith-based community leadership, Bangladesh, with Sneha Krishnan.
Hi, just a second. I'll share my screen. Can you see? Am I audible?
Yes, yes.
Okay, and you can see the screen.
Yes.
Thank you, everyone. It's quite hot afternoon here in India, but I'm sure many of us are joining us from Europe, so good morning to everyone. My name is Dr. Sneha Krishnan, and I'm going to be presenting work that we undertook for Christian Aid. So I want to thank all the team and the work that went behind this evaluation program. I am also adding some of my reflections, which are my own and do not reflect all our team members. So please bear with me. Today we are presenting about faith in the times of Corona, where we actually wanted to evaluate the role that faith-based leaders can play in COVID-19 preventive strategies, and particularly from the perspective for Rohingya refugees in Bangladesh. I would like to begin usually with the conclusions. So if I lose some of you during the presentation, you'll remember three things from my talk today. What I want to argue here is that we need a wider understanding of what we mean by faith-based leaders. So remember, it's not just, at least for in Islamic religion, it's not just the imams and majis, but a wider group of people who influence religious practices and thought in the community. We also want to highlight another key important aspect of empowering the Rohingya communities in displaced settlement. So focusing on their cultural practices, focusing on their ideas and perspectives about COVID-19 and what it means. And lastly, trying to be more inclusive in involving women and involving children, adolescents in how faith is practiced and can be linked to COVID-19. So having given away the plot, let me now come to the gist of my presentation. The background for this research was Christian Aid was trying to understand what role can faith-based leaders play. There is some evidence of engaging with them in the Ebola context in Sierra Leone, and some scattered evidence on the role that they can play for gender-based violence. These are often leaders who are situated in the mosque and offer prayers, and they are considered to be powers of having a lot of power, so in a position of authority in the community, especially for people who come from Myanmar, because they trust them for having made the journey from Myanmar to Bangladesh. So the question that we were asking was, how effective can these faith leaders play an active role in changing behavior, especially in the context of COVID-19 in this community in Cox's Bazar? Um, the methodology that we adopted had a four-pronged strategy. We looked at existing literature on faith-based leaders from the lens of health, from the lens of humanitarian programming, as well as cultural pieces, trying to understand how communities would trust and build a relationship of solidarity with these faith leaders. We interviewed not just faith-based leaders in the community, but also other people who held position of importance in the community. We undertook household surveys in both the host and the refugee communities, and some focus group discussions in both host and refugee communities in two camps in Cox's Bazar. This was a very challenging piece of work, because it was all done during the pandemic. So the work began in December and completed in January. And the team was locally recruited and selected. And some of the insights that I would share for the group, because we are interested in evaluation, is looking at how mixed methods research could be carried out using digital methods and enhancing the team capacities through digital workshops, and what are the pros and cons of doing that. We can have a discussion around those. Uh, we were also very understanding of the fact that although the language is quite similar, the Chittagonian dialect and Bangla, the fact that person of the host community is going and asking these questions to the refugee community could have some issues when sharing the data. Um, this also brings us to the point about what were the challenges of recruiting Rohingya volunteers for the project, because organizations cannot easily hire them, and there is also questions about capacities and ability for using mobile phones, because they are not allowed to have SIM cards in Cox's Bazar for Rohingyas. Um, and so therefore, if this research is being carried out digitally, then what are the mechanisms that can be used, and we can impart to the team, to the data collection team, so that they are able to build the trust and rapport with the communities that they are collecting data from. Some of the findings from this research, just in verbatim, what are the Rohingya community members telling us? Um, there is this recurring idea that in Quran, there is an idea of being clean, and one of the preventive messages that was given out by WHO for preventing COVID-19 was also to wash hands and to maintain hygiene in their surroundings. So it was very easy for the community members to connect this idea of cleanliness. However, there were a lot of limitations on how they could practice the other preventive measures due to lack of different facilities. Um, some some would mention that because they live in crowded spaces, it was difficult to maintain 3 feet distance. Whereas other imams, one of the informant was actually sharing his experience of believing that Allah was the reason why COVID-19 was spreading. It was more of a very fear-based approach to why everyone is suffering from this. So there were a lot of misconceptions, as we'll find out. Uh, One of the key interesting part that the religious leaders played was to connect the idea of COVID-19 preventive messages with what is being said in the Quran. So during the Friday prayers, they would repeatedly give out the message of physical distancing, of using masks, and repeated hand washing. So when we checked with community members of where did they get their information from, this was what they remember saying, from mostly from imams and muezzins who are based in the mosque. Whereas when we asked them about what are the reasons why the disease spread, sorry, I can't see. Yeah, they gave multiple reasons why COVID-19 was spreading. Some would believe that it was because we were not praying. or women were not following parda, or this is what Allah wants, this is his way of testing us, of teaching us, and basically not following the rules and regulations from the scriptures. There were also several misconceptions and misinformation which was spreading. Many people thought this was a government conspiracy to remove the local, to separate the refugees from the local communities. Some believed that COVID-19 was an insect or it spread through animals' body, and especially concepts about being unhygienic, which is often associated with elderly people, came up repetitively in many of the interviews. Um, Moving on, when we try to understand whom would they trust most when it came to matters about health, we did find that there was a clear trust that they held with the health center workers. But in the absence of health workers who would come out to them and reach out to them, they do go out and obey information which is given from either the camp management or the Maji, the commander-in-chief of these camps. Um, the, sorry. There was also this idea of using the mosque as a social space where people could meet, congregate, and after the prayers have a discussion around their religion, but also their personal lives, and be able to discuss matters of health with the imam. So therefore, enhancing their awareness and working with them to understand these misconceptions was a key area of intervention. So what we did was we mapped some of the findings that we got to barriers, opportunities, enablers, and threats to understand behavior change. I wouldn't go into much detail so that we can use the time more for discussion. But as was understood and as it was preempted even before the pandemic began, that in mass displacement settings, it would actually be quite challenging to practice these preventive strategies. It was true even in the case for Cox's Bazar, like we saw one of the quotes, which was about inability to maintain physical distance in these overcrowded settings. There were also concerns about lack of drainage facilities, lack of water, clean water to wash hands, because the drainage and the water facilities and the sanitation facilities were all clustered around each other. And for those who can remember seeing one of the images, the communities are actually living on a hill slope. So for them to be able to ensure that they do not meet each other or maintain physical distance was also quite difficult while commuting from one place to the other, or even going to the mosque or to the health center. There were also social barriers in how the mosque, only men would go to the mosque, whereas women would actually pray at home. But we did engage with some of the women leaders who practice preaching of the Quran. So she would go house to house and meet the women and children and help them learn the Quran on a regular basis. So some of the interviews that were done with these women leaders actually uh, was more insightful in understanding how these women leaders understand COVID and then pass on the message to majority of the Rohingya population. And that is where the idea of the biggest barrier about illiteracy came up again and again. So women not being able to understand or read the messages which were given out in Bangla, because Chittagonian is a dialect, it doesn't have a written language. So there was no message which was given in their own language. So that posed a huge barrier in how the messages were communicated. There was also an element of not just about literacy, but also about use of mobile phones, which is how agencies were trying to give out messages using WhatsApp or YouTube videos. Um, and also in the context of Cox's Bazar, connectivity was a huge issue. So access to internet, mobile phone usage, especially for women, was also not was also creating a barrier. We've already seen several misinformation and misbeliefs around faith, but what this led to was also deterrence of people's faith in the health system. We spoke to some of the doctors in the health post who worked with the local NGOs, who would say that people started believing that COVID was a hoax which the government had created, so that people who were tested as positive were actually being sent away back to either Myanmar or some other place. So therefore, even if they had some symptoms, people would not prefer to go to the health center and get tested because of this misbelief. And there was an overall mistrust with the health system in how medicines were not available, or the staff or nurses were actually not polite with the refugee population. So these were not major as such, but it also affected how they interacted with the health system. Another interesting piece which came up was, uh, in the absence of then going to the health center, what would people do? Is relying on local traditional healers who would give um, herbal medicines or different kind of alternate practices, which would either uh, try and solve their problems. Without getting into much detail about whether this was right or wrong, we wanted to understand who are these health practitioners and what kind of learning do they have. And we found that most of them are involved in uh, during the pregnancy, during the delivery of a child, and they are not trained much. So people would also look up to them for information at some point. Moving on to threats, like we discussed barriers, one of the challenges that we found that using this idea of intersecting COVID-19 with faith also had the challenge of associating who is clean, who's not clean, and who's being unhygienic. One of the theme that emerged was people would often illustrate that elderly population or people who cannot look after themselves tend to be very unhygienic. So they are carriers of COVID, is what some respondents mentioned. And if they just remain clean and if everyone practices cleanliness, then they will remain safe from COVID. Was also not entirely true. So therefore, this balance between what do we preach from the religious perspective and what do we advise from the scientific perspective was a very thin line, and it was up to the faith-based leaders on how they manage that. We also probed a bit on their interest in taking vaccine, and there were all sorts of misunderstandings about how this would affect them, at least from the community perspective. But some of the faith-based leaders who had access to internet or who are well-read up to what is happening globally did say that we do want our people to be safe as well. So if there is an opportunity to take vaccines, we would encourage our community members. Um, and some other threats and risks that we mentioned were these populations were not only affected by COVID, but also facing the threat of cyclones, fires. There was a big fire that happened in January this year. And harsh winters and not having enough non-food items which will help them tide through these emergency periods. Um, Other than the regular lack of services, there was also limitations of food and shortage because of livelihood disruption during the lockdown. So therefore, a lot of areas were emerging where not just because of COVID, but also other emergencies were affecting their lives. In terms of enablers, some positive side to the story. We see a clear role that faith-based leaders could play in linking the guidance from Quran and the messages from WHO and the government of Bangladesh. We also saw a huge potential that madrasa teachers who were actually um, the madrasas had shut during the lockdown. So they also played a very crucial role in not just imparting about Quran, but also preaching to children about different ideas related to science. We found they were very up to date with the information on COVID. And like I said earlier, women leaders who are often outside of this institution of faith also play actually a very important and active role. And for humanitarian programming, they play a very important area, and it is something that I think Christian Aid is also trying to understand how to go forward with. Um, there was repetitive messages which were given through megaphones and through committee members, but this was also very one-sided. It wasn't. It was a very monolithic way of communicating. But this was done through the faith committee members. And therefore, like I said earlier, the opportunity to engage with faith-based leaders by widening our understanding of who a faith-based leader is and training them for public health transformation is a very crucial area, which I think humanitarian programming is just trying to understand. We've seen several presentations in this conference within this week through JLI, where they've come up with different case studies as well. Engaging these faith and community leaders for vaccination is another opportunity which might, which is also to be explored. And although there were different ideas about what elderly people are exposed to, there was a consensus that they are the most vulnerable, so we need to protect them. So there are some ideas which the community has. It's just to understand and enhance them further. And from the health system's lens, strengthening this trust between the community members and how they access the health center, and trusting the health services to cater to their needs as and when required is a huge area, is a huge gap. And with political reforms, perhaps that will be initiated. So humanitarian actors could play a role in advocating for that. And another gray area of further research could be understanding these traditional healing practices and what can we humanitarian actors do about them without having much knowledge about it at the moment. A lot of respondents actually reported that they were washing hands. So that came out to be a very positive finding from this study. And some of Christian Aid's approaches have positively included these faith leaders in their feedback mechanism. I think that is a case study in itself, which will enable other humanitarian actors to learn from this experience. So just to summarize, I already said this in the beginning. I would recommend three ways. We would recommend three ways in how we can understand faith-based leaders and their role in health emergencies. Is A, through widening the scope of what faith-based leaders can do, empowering them, and also including other members from the community within this system of faith by including more women, including people who are disabled, and elderly and adolescents, and incorporating their views and voices as part of the feedback mechanism. That's it from my end. If anyone has any questions, I breezed through most of the slides, so if anyone read something and they want me to elaborate further, I'll be happy to do that. Thank you.
Thank you very much, Sneha, for this excellent and very interesting study. So please, if you have any comment, raise your hand or use the chat box below. We have a question from Beatrice.
Yeah, I'm just trying to read. Yeah. Beatrice, do you want to speak or shall I read out? Thank you for your presentation. What they have responsibility in corporate social and conducting the research. Yes, Beatrice. Like I said, there was very minimal movement, and a very small team was responsible for collecting the data. So I think there were 4 team members who collected qualitative data, and a similar number, separate 5 who went on later. So we did a sequential methodology where we did the qualitative first, took a break, and then did the quantitative. which is not often possible, but this time we ensured that was done to maintain safety for the team members. Um, you're right. When undertaking focus group discussions, we involved half of the number that is usually recruited for research. But we try to do similar number of FGDs in different camps that we were working on. As per working with key informants, a lot of these were done through phone. I think many of the members who are not based in the camps but are at least based in Cox's Bazar or in Dhaka could be easily accessible through phone calls. So that was a huge benefit. Um, Language is a challenge, but we did have a lot of help from our team members in Bangladesh who enabled that for us. I hope I've answered your question. Yeah, Mervat. Hi, Mervat.
Hi, Sneha. Thank you for presenting this important work. It's really interesting. I have, I think, a 3 questions, very small one. So first, I wonder if you, if for the exploring the misinformation that the communities have, were there any differences between women and men in terms of how they are informed about the COVID-19? My second question, I wonder if you explored any misinformation about on the COVID-19 vaccination in the community, and what was the results of that? And the last question, I'm sorry if I missed that, but did you publish the work or not yet? Because that is super interesting. Thank you so much.
Thank you, Mawad. It's so good to follow up after your presentation like yesterday. Your first question about differences between men and women, yes, clearly, I think the sources of information, starting from the sources of information and how it was presented to them, there were a lot of differences in how men accessed information and women accessed, especially for mobile phones. It's not everyone owns a mobile phone. Not everyone knows anyone who has a mobile phone. So women were often had a very indirect relationship with mobile phone usage. And like I said in my presentation, only men would go to the mosque for Friday prayers when the lockdown was lifted. So it was men who were getting the first-hand information about COVID from the imams and majis, and then they would go and pass it on to the women and other members in the household. So there was an indirect passage of how information was passed on. So clearly there is a lot of difference in that. Even with the women faith leaders and male faith leaders, we could see the differences in perceptions of being more fatalistic perhaps, or the things that they would suggest on what they can do to prevent themselves. So women should stay inside the house, so they should not go out. So in some ways, it was reinforcing what was already quite prevalent in a patriarchal setup like Cox's Bazar. So yeah, I think there is a danger of not involving women in these communication strategies. Your second point about COVID-19 vaccination, we did not have that as an objective for this research. Because Cox's Bazar and the legal status of the refugees and understanding how vaccines would then reach out to there, it was all a gray area when this research was designed. We did check with the faith leaders on their perceptions about what COVID-19 is, but we didn't, the answers were very superficial. We couldn't get much nuance from just one question. Some leaders said, yes, we would advocate for vaccines, while others said they have this mistrust of using vaccine anyways. So it wasn't enough. We don't have enough data to comment on that. No, we haven't published it yet. Christianate is finalizing the report, so it should be available once our friends have that ready. But I can share with you if you're interested.
Thank you so much. Yes, please do. Yeah, thank you.
Thanks, Mavan.
Thank you, Sneha. Any other question for Sneha before we move to Beatrice?
Thank you, Dr. Anis. It's been fantastic.
Thank you very much.
I'll stick around.
Thank you. Thanks a lot. Now, with our next paper, Deserving Families, the role of familial norms for conditional cash transfer in Latin America, with Beatrice Borattini and Isabella Franciscon. Beatrice, you have 20 minutes presentation, followed by 5 minutes question and answer.
Okay, I will share my screen.
Yeah, please.
Okay, so I will start now. So good morning, everyone. Thank you for coming. And also thank you, Dr. Anis, for inviting us to participate in this conference and this panel. My name is Isabella, and together with my colleague Beatriz, I'll present the paper Deserving Families, the role of familial norms for conditional cash transfers in Latin America. Beatriz and I are both researchers at the International Policy Center for Inclusive Growth in Brasilia, Brazil. It is a partnership between the Brazilian government and the United Nations Development Program. So quickly, okay, our outline for today. So Beatriz will start with the motivational key concepts and the methodology of our paper, and I'll then discuss the findings, focus on the case of Brazil, of the emergency cash transfer created to respond to the COVID-19 crisis, and then present some of our key conclusions for this paper as a whole. Okay, so Beatriz, you may go on now.
Thank you, Isabella. Hello, everybody. So I'm Beatriz, and I'll be presenting the motivation of this chapter. So our aim with our chapter was to analyze which norms and assumptions regarding families are behind design features and conditionalities of cash transfers and cash responses to COVID-19 in Latin America. And to see whether family ideals have served as a basis for program designs, and to which extent these ideals have constructed the deserving poor who deserve support more. During this presentation, because this panel focuses on evaluation during COVID-19, we will be focusing on our results for the Brazilian emergency cash transfer auxílio emergencial. And because we use the discourse analysis, we also want to instigate a discussion to consider the role of discourse analysis as a methodology to evaluate programs, because as a methodology, it allows us to analyze not only, to evaluate programs not only based on their explicit objectives, but also to see how policies and programs reproduce social norms, how they're embedded in social norms, and how they can exclude people based on the behaviors and norms that they promote. Isabella, could you please move to the next slide? So some important key concepts include governmentality. So this is the rationale through which governing actors decide what is to be governed, why, and how. So it's a programmatic process. This means that the practice of government follows a goal to improve society. Therefore, this is the, this programmatic goal is the why society is governed. It's not inherently supposed to be understood as a good or bad thing. It just means that governmentality has a goal, and it is discursive because it exercises a productive type of power in which power is exercised by creating and controlling knowledge, and this knowledge is what is the basis for individuals' decision making. So this part of controlling and producing knowledge entails that through language and through discourse, realities are constructed. So discourse constructs realities through statements, where statements create meaning. And connecting these with government, this means that, for example, if groups of people are discursively constructed, so through language, they're constructed as undesirable, they're people with behaviors that are seen as undesirable, they may be seen as people who justify, for example, a more repressive rationale of governments or a more liberal rationale of governments. Therefore, let's say a more liberal governmentality that allows them to behave as they want, or a more repressive governmentality that tries to change their behavior more. Next slide, please. Right, so also related to that are the concepts of regulated autonomy. So here, by shaping individuals' desires, the governments can governing actors can govern persons and entities. And key for their regulated autonomy is, for example, the family, as we will see with our findings. So by delegating government to the family, governing actors don't have to be present at all times. So by discursively creating notions of acceptable and unacceptable families, you can ensure that, for example, the parents ensure that the children behave in a way that is ideal for whatever goal there is for society. For example, ensuring that children go to school so that the government actor doesn't have to do it themselves. Relating to that, there are the concepts of normalizing, marginalizing behavior. So this can be done through discursively constructed social norms that create categories of acceptable and unacceptable behavior, on which regulations are based to incentivize the former and prevent the latter. And these normalizations of behavior can create behavioral scripts that are norms for thoughts and behavior, which create roles to which individuals adhere subconsciously. So to summarize, what is key in our theoretical framework is that policies can normalize behaviors that create those behavioral scripts. And this is important to ensure that regulated autonomy is possible, for example, by delegating government to the family and linking that with more oppressive or more liberal governmentality. It means that, for example, if a family doesn't adhere to the behavior that a policy is trying to implement, it can be seen as desired or undesired, and through policies, these families can be punished or not. And this is key for our paper. Isabella, please, next slide. So in our methodology, in general, so our chapter that we wrote, we analyzed flagship conditional cash transfers in Latin America, including their expansions during the COVID-19 pandemic. Today, during this presentation, we will be focusing on our findings regarding the Brazilian Auxílio Emergencial, an emergency cash transfer that can be seen as an expansion of the Brazilian Bolsa Família program that was implemented during the COVID-19 pandemic. However, please note that our findings are based on our research up to December 2020. And we analyzed the cash transfers looking at their program designs and how these designs could benefit or exclude different family types or promote certain family roles. So when we looked at the design elements, we looked at conditions, target groups, benefit recipients, beneficiary limits, targeting methods, eligibility criteria, and motives for benefit termination. Here, just one remark, it may seem confusing that benefit recipients and target groups are not the same. This is because in some cases, some programs have provisions for which family member gets to actually receive the benefit representing the household. Next slide, please. Right. So after we looked at the program design elements, we look at, we found some tendencies, and in the case of the Brazilian Auxílio Emergencial, we chose that as a case study because some of the findings from the program design show that there's often a prioritization of women and mothers over fathers and men as benefit recipients. So I picked this benefit as case study and examined within the Auxílio Emergencial how it reproduced family ideals by analyzing how those ideals were used to justify the restrictions in the Auxílio Emergencial. To do that, we conducted a Foucauldian discourse analysis of the political debates and legal documents surrounding this program design. And during this analysis, we considered the policymakers making statements as people who are themselves defined by discursively constructed realities. So this points to the importance of context and communicative acts when analyzing social protection programs. Next slide, please. Now, there are a few limitations to our methodology. So as I just said, we only looked at up to December 2020, and the pandemic is very dynamic. So many things may have changed since then. Then the findings are very context specific. So they're not some findings that can be generalized very easily to other contexts. And discourse analyses have some specific limitations. So on one hand, when we analyze those language units that create meaning, we need to ourselves interpret which language units are meaning creators, where they start, where they begin. So this is up to interpretation. So this may change from one researcher to the other. And then there's another limitation that we tried to address during our research, which is that discourse analyses are often criticized for only seeing statements as creators of meaning and not taking them very seriously in terms of the information that they provide. But we actually try to respond to this limitation by actually taking seriously the content of the statements as valid information as well. So now my colleague Isabella will introduce you the findings of our research focusing on what is relevant for the COVID-19 pandemic. Thank you very much.
Thank you, Beatriz. So as Beatriz mentioned, I'll proceed now to discuss our findings regarding the Brazil Emergency Cash Transfer, the Auxílio Emergencial. So it was created to alleviate the socioeconomic crisis and implemented in April 2020. The initial benefit amount awarded was 600 reais. Yes, that is the currency in Brazil per month. But we should note, and that's what you are investigated, that single mothers, but not single fathers, were entitled to receive double the amount. So we used this Foucauldian discourse analysis that my colleague Beatriz just explained to investigate the family's norms and goals and justifying this prioritization of families headed by single mothers. We could see that in the Brazilian Congress and in the President's Institute, the analysis of documents and discourse and debates within the Brazilian Congress, that these gender family roles were questioned, and there were representatives of the idea that women and single mothers should be prioritized, and just then should receive double the amount of the benefit, but also representatives of the idea that although single fathers are the minority, yes, and we know that through the data, yes, that is collected in Brazil, they should be treated with equality. But nonetheless, in the end, in the final decision, the benefit was double for single mothers, but not for like single fathers. And let's now see why and what were the ideas behind it. So our key finds in the Brazil's case, this clash of discourse is on one hand, women should be prioritized and just receive double the amount. On the other hand, that single father and single mothers should be treated equally. Was used the evidence regarding gender-based abuse and male parenting. So as I mentioned, it was used data to show that in Brazil, the families single-headed were composed by single mothers, the majority of them. Also data showing that many children in Brazil do not have the name of the father in the birth certificate. So there was this construction, this discourse construction of males and fathers as abusive and fraudulent and also absent. It was used also evidence during the pandemics before this final decision came, that fathers were using the data of the children, claiming the benefits that should be to the guardian, just of these children, as they were the guardians, but they actually were not. And then when single mothers tried to access the benefit, they were denied because the benefit was already awarded, but not to the truly guardianships. And also, I'm sorry for that, because my cat's playing. Okay, so continuing. Also, there were practical concerns due to the need to quickly implement the emergency benefit, yes, in the crisis. So there was a lack of data, a lack of a tool to quickly and properly verify the guardianship of fathers. And so considering that most of single-headed households are like headed by women, they decided to just give the double benefit to them. So we see in this way that female and single mothers were constructing a more deserving, attracting a more legitimacy to social protection. The males were constructed, on the other hand, as less deserving, and these families headed by single fathers penalized, reinforcing the notion of absent fathers. And we see that the design choice, like to safeguard women children from these absent and malevolent fathers, normalizes the role of women as caretakers. Yes. And we saw also that short-term objectives of quickly responding to the cries were prioritized in comparison to the longer-term gender equality goals, in this case in Brazil. Next, I'll just quickly present our key conclusions for this paper. As Beatriz explained, we focus here on our findings that are more relevant to this panel. But we analyzed the sample of 29 programs in 21 programs of conditional cash transfer programs. Okay. And we were expecting to find the conditionalities that are explicit attempts to conduct behavior would be the main components of CCT used to reproduce familial norms, and to normalize behaviors, but actually not. We found that the limitations on the number of household members entitled to receive the benefit was one of the key tools used to that. So 17 programs of our sample. And just to explicitly state that there was no limitation. So for instance, an amount of benefit, defined an amount, regardless of how many people, how many members there is in the household, or a cap, like of 3 children per household, for instance. And the prioritization of women's benefit recipients, as is the case of Brazil, that penalized single fathers in the context of a crisis. There is 18 programs, or 62% of our sample. So this points out to the need to look beyond conditionalities, which are like the most obvious design tools for influencing behavior, toward other less explicit incentives and punishments that may influence familial norms and influence behavior and choices. Okay, so I finished my presentation now. Thank you. Yes, if you have any questions, we can answer, but you can I also feel free to email Beatriz and I. We'll be glad to receive your comments. Thank you.
Thank you, Beatrice and Isabella, for the very, very interesting presentation. So please, if you have any question, raise your hand or use the chat box below. Any question for Beatrice and Isabella? Clement?
Yes, thank you, Beatrice and Isabel. I think it was an interesting presentation, and I was particularly intrigued by the idea that fathers were actually excluded from being the beneficiaries of the program. So I just have a quick question. I was wondering, how many do you have statistics of how many single mothers actually benefited from the program? And also, secondly, I was wondering whether maybe in the future there is the possibility of actually undertaking further research, maybe to understand the implications of excluding fathers from benefiting from such programs. I think it may have wider implications on families. So those are that's my question and also my comment. Thank you.
Thank you very much for your questions. So we don't have the data on how many single mothers are covered right now at hand, but we can check whether this data has already been gathered. Keeping in mind that the pandemic, well, yes, it's very dynamic. So the data, yes, the data that is available might also be outdated, but we can check for the data and send it to you if you would like. About your other question about additional research, future research about the consequences of excluding fathers. So first I have one comment. So this is not just about the Brazilian context, but others as well. So for the auxílio emergencial, there was this difference in benefit amount that benefited mothers more than single fathers. But I would like to emphasize that in general, many cash transfers, they have the woman as the primary benefit recipient. So it doesn't necessarily mean that it's always excluding fathers, but it is trying to benefit the mothers more. So that just to clarify, but it also depends a bit on the context. There is, so for conditional cash transfers, because there are other types of cash transfers in Latin America that try to transfer the money to the woman in the household. So there have been other studies looking at the impact on gender in Latin American countries. So there have been criticisms, for example, of conditional cash transfers that focus on transferring the money to women, that it might, kind of allocate more responsibility to women, kind of almost too much, burdening them with both, let's say, being a provider for the household and for doing reproductive labor. So I suggest you look at those impact evaluations looking at gender in Latin America, also from before the pandemic. Yes, no, I definitely think that there is room for future research on this kind of exclusion, or I can't think of the word in English right now, but yes, this kind of seeing as fathers as like secondary, and I believe now after the pandemic, it might also be interesting to further look at fathers and the pandemic response. Thank you. I don't know, Isabella, if you have anything to add. Otherwise, feel free to add questions.
Okay. Thank you, Beatrice. Yes, for your answer. I just like to add here some of data that we have in our paper that can give you an idea of the situation, a better idea in the situation in Brazil and why this decision was taken. It was this data was actually used, yes, in the Congress and the documents to help to justify it. So according to the data in Brazil, more than 80% of children have a woman as the main caretaker, and 5.5 million children do not even have the father's name in the birth certificates. Even more than it was around 6% here of families where the women is responsible for providing income living in poverty. So it's common in Brazil that women are the main caretakers and also the breadwinners in the family, and the father is absent, and we can see it in the data as well. So I think that it was mainly a decision of what could benefit more people in a crisis and in an emergency situation. And as there was no means and effective tools to quickly check who is actually taking care of that children, who's being the guardian, they took this decision. It's not that I think that the Congress and the government of Brazil ignores the necessity of promoting gender equality, but in this specific situation, I think that was the way out that they found. Okay, does it answer your question?
Thank you very much. Any other question before we conclude this session? One of the speaker, the third paper on Yemen, requested to move his paper to the next panel at 4:15. So any other question before we conclude the session? So if there's no other question, I'd like to thank all the speakers today, and thank you for attending this panel. I look forward to see you in my next panel at 4:15. We have 3 papers on evaluation in the Global South. Thank you very much for attending, and have a great day.